Summer cough causes and treatments. Coughs can be caused by allergies, asthma, infections, air pollution, acid reflux, dehydration, and postnasal drip. A cough can be classified as wet, dry, productive, non-productive, chronic, acute, whooping, allergic, or smoker's cough. Treatment depends on the underlying cause. Summer coughs can be caused by allergies, asthma, infections, and air pollution. Acid reflux and dehydration can also cause coughs. Treatment may include antihistamines, asthma medication, antibiotics, or lifestyle changes. Summer allergies can cause coughs due to pollen from grass, trees, and weeds. Treatment involves avoiding allergens and using antihistamines or nasal sprays. Summer heat, humidity, and pollen can trigger asthma attacks and cause coughs. Heat, humidity, and pollen. Treatment involves medication and lifestyle changes. Summer colds, flu, and other infections can cause coughs. Treatment depends on the underlying cause. Summer smog and poor air quality can irritate the lungs and cause coughing. Treatment involves limiting exposure to polluted air. Acid reflux and dehydration can also cause coughs. Treatment involves lifestyle changes and medication. Postnasal drip can cause coughs, and treatment may include over-the-counter medications. If you have a summer cough, see a doctor to determine the underlying cause and receive appropriate treatment. Treatment may include medications, lifestyle changes, and other interventions. Seek medical attention if you have a persistent or severe cough.